I'm Ian Marshall. I'm a doctor working in the day hospice, but I've actually worked at Eden Valley Hospice for 20 years now, 20th year this year, working on the ward initially and then more latterly the last few years in day hospice. So kind of involved in running an outpatient service there, but I also often the first port of call for new patients when they arrive. Sometimes the first time they've had contact with anyone at the hospice. So it's a bit of an ice-breaking kind of appointment. And I effectively clerk them in and get to know a little bit about the patient and their families and try and get a good gist of what's going on in terms of their health. I had always had an interest from being a junior doctor in palliative care, and so I worked with the palliative care teams in the Yorkshire hospitals I worked with and did a hospice job while I was training as a GP. And so I was always looking to be a GP with a special interest in palliative care. And the practice I work with, which was Brunswick House and is now part of Carlisle Healthcare, used to run all the medical cover at Eden Valley Hospice. And they advertised for a full-time GP with a special interest. It was kind of almost like written for me, and I luckily got the job. And I came and worked as part of the practice. We used to come and do clinics and ward rounds here. And then after a few years, the practice pulled out of the hospice and it became consultant run and had its own staff. But they asked if I would stay on, and I did. And as I reduced my hours as a GP and came here, and I love it. It's a really nice balance between, it's like being a GP but with quality time. So you get time with your patient. You can have up to an hour if you need with one patient and their family, and you can do the job better. And so kind of work alongside. I tend, when I work here, I don't take over the patient's care. I work alongside the GP. So if I see someone in clinic and we decide between us that maybe some medication changes might be useful for symptom control or something, I will liaise them with the GP surgery and run it past them and ask if they would prescribe the drug. And that keeps the GP in the loop, and it means we're not stepping on toes or taking over care, but working alongside them. And it kind of builds a nice relationship with the GP practices and what we do. I tend to work on a Tuesday and Thursday morning, and in that time I might meet one or two, sometimes three new patients and do the ice-breaking job of getting them introduced to our service and what we do, clerk them and find out a little bit more about their needs and introduce them to the wider team. But not only that, my days are designed around the days where the day hospice patients might have more medical need. And so what I will be able to do is if a patient comes to day hospice and they're not feeling particularly well, or they've got symptoms, or they've got questions they want to ask about their treatment, or they're anxious about something, then they can ask to see me, and so I'll be meeting new patients, but then reviewing a lot of our existing patients. And so on the Tuesday and Thursday, we've kind of designed the day so that the patients maybe who need that kind of input, rather than a more social daycare model where they come for a bit of time out, but they might need more medication or more medication reviews. That's another role I have. So I tend to work alongside the team. They'll highlight any patients in need, and we try and work these out. And then I liaise with the GP, but also oncology. If someone needs a scan or maybe some treatment like radiotherapy or chemotherapy, I liaise with the oncologists as well and try and highlight and kind of fight the case of that patient, because we're seeing them maybe more often than they are. So if someone's developing new problems, new pain, then I can get involved and sort things out earlier, hopefully. I've got a real attachment to this place. I've been here a very long time. I've watched it evolve. I'm really proud of what it delivers. And I think when you work in palliative care, it's definitely a calling. It's not something you do for the money. It's not something you do for any other reason than you really love the work. And I think there's a huge joy in spending time with people at this time in their lives and being able to make a difference, ease their pain, ease their anxieties, work with their families and support them. And the team we have working here, just a joy to work with. So it's home, really. I love my general practice job, but this is where my heart really sits. I do love having the quality time with people, and I think you get a lot back from patients. I think they're always very grateful, and quite inspiring actually. We have a group in particular on a Tuesday at the moment who just leave you feeling very inspired every week. You leave going, how lucky am I, and how amazing are these ladies who complain about nothing and deal with their complex situations so well and bravely. And it's a real honor to be around people like that, and I think it's not a job when it's like that. It's just hugely rewarding. Some years ago we had a young lady who sadly had quite advanced bowel cancer and was very poorly, and sometimes the word hospice evokes quite an emotional response from organisations outside of here. And I remember this lady particularly wanted to see a certain film as it came out, and we just rang the View Cinema and said, is there any chance you could do anything? The View put on a private viewing for this lady and all her family. And they were given free hot dogs and popcorn and everything, and we took her in the ambulance. She was very poorly at this point. Took her in the ambulance, and were able to sit and watch the film with her. And it was just for when you see people pull out the stops to help a family like that, it's hugely rewarding. And we were able to be part of that. It was just one of those memorable moments.